We recognize that health is a partnership. Across the country, First Nations people are taking up the challenge of empowering ourselves and taking greater responsibility for our own wellness. This DVD is about laying a foundation for working together in a better way. It has come about as part of an ongoing initiative by the Interior Health Authority to ensure the provision of culturally appropriate services for Aboriginal people. With this DVD, we respectfully invite you to learn more about our people and to gain an understanding of how we can be more effective partners in healthcare. The reality is that many Aboriginal people still experience profound barriers in accessing healthcare services. Some barriers include poverty, lack of transportation, and lack of childcare. In 2008, it was reported that out of Canada's 58,000 physicians, only 100 were of Aboriginal heritage. In effect, this means that almost all Aboriginal people in Canada meet their health needs with non-Aboriginal doctors. These figures emphasize the need for non-Aboriginal health professionals to learn about cultural safety. And cultural safety is the framework upon which this DVD is structured. This DVD is a journey into cultural safety. It will equip you with an understanding of the First Peoples of the Okanagan and provide you with practical tips for enhancing your capacity to support us and other Aboriginal peoples you encounter. The DVD takes you on a journey that is intended to strengthen our relationships with one another here in the Silk Territory and what is in the state of those relationships today. Research done as part of a long-term study by a collaborative team from UBCO working with Aboriginal organizations in the Okanagan Valley found that it is common experience for Aboriginal recipients of care to be subjected to stereotypes that amount to racism and discrimination. Erroneous assumptions made by healthcare professionals resulted in negative experiences that prompted patients to avoid accessing services. By explaining the restrictions of the current healthcare system, the project helps Silk people understand that the system is too big to provide the kind of holistic services that would be more consistent with our traditional orientation towards wellness. It's about finding complementary ways to weave Silk and non-Silk cultures together when it comes to healthcare. You can make a difference.